Listening Part A. You hear a doctor talking to a patient called Mrs. June Wilcox. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So, Mrs. Wilcox, your GP referred you to me because you've been having a bit of trouble sleeping. Why don't you tell me what's been happening?
Okay, yes, that's right. I suppose I've always had some trouble breathing fully through my nose, especially through my left nostril, but I feel like it's been worse in the past few years. I used to play a lot of sport, especially netball, but I've had to give it away because I was getting so terribly short of breath. So while it's there during the day, the blockage, it's even worse at night. When it's time for bed, well, sometimes the left side of my nose can feel completely stuffed up. My husband tells me that I've been snoring as well. It started a little over 12 months ago, I suppose. Yes, probably 12 to 18 months.
Do you feel tired in the morning?
I do, yes. Sometimes it can feel like I've hardly slept at all, and the back of my throat tastes like I've smoked a pack of cigarettes. I've tried some of those sprays, those ones that you can get from the chemist, those decongestants, just to try and help clear my nose a bit. They used to work, but then after a while, they all stopped being effective. Then, when I first spoke to my GP about what was happening, she prescribed a spray for me. It's a combination corticosteroid antihistamine spray. It was wonderful. I really thought it was going to fix it right up, but she said I shouldn't really stay on that long term because she thought my issues were more structural. That's why she recommended I come and see you.
Okay, great. Do you mind if I take a look? This won't hurt, but it will allow me to confirm your GP's diagnosis.
No problem.
Okay, thanks. Well, it definitely looks like you have a deviated septum, and you have some quite large turbinates as well.
Right, okay. That's what the GP said, wasn't it?
Yes, it isn't so unusual. Almost no one has a completely straight nose. The issue is that yours is affecting your breathing, and that's making it harder for you to sleep.
Yes, that's right. Can it be fixed then?
It can, yes. The best option is usually a very simple surgical procedure called a septoplasty.
Right, I see. Surgery. I'm not so keen on that. The only other time I had surgery was on my knee, and it wasn't very successful. If anything, I think it actually made it worse.
Well, septoplasty is very successful and very common. It will allow me to straighten and align the cartilage structure that exists in the midline of your nose, and you'll find you'll be able to breathe much more freely after that.
I just don't know if that's the way I want to go.
There are other options we can try, perhaps less structurally invasive. I can outline some of those if you like.
Yeah, I just don't know. I can suffer with a bit of anxiety sometimes, you see. It's something I've had to battle with for a while now. I suppose I'm just a little worried that if we decide to go ahead with surgery, I might have some sort of panic attack, on the day itself. I just don't know what I should do.
Listening Part A. You hear a specialist physician talking to a patient called David Johnson. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
It's nice to meet you, Mr. Johnson. You've been referred to me by Dr. Bruce. Why don't you tell me why you're here?
Yeah. About a week ago, I was in a car accident. Nothing really happened at the time. I spoke to a doctor that day, but he was still a bit concerned. So a couple of days later, I think it was about that, I definitely started to feel a little bit different.
So what happened when you first went to the doctor?
Well, right after the accident, there was really no problem. I didn't feel anything. It didn't hurt at all. He did say, the doctor I mean, he said that I should just watch out or pay attention to see if I had a sore neck or sore back or anything. And that's what happened. A few days later, I was starting to feel a little bit dizzy. And then, well, that's when he said it was definitely whiplash and he referred me to you.
Okay, and so how have you been feeling since then?
Well, I've definitely had a sore neck. It's really been bothering me the last day or so. And like I said, I've been feeling a bit dizzy. Actually, I have to sit down once in a while because it gets a little disruptive. Difficult to work and that sort of stuff. I've been feeling a bit sick too. I actually had to take yesterday and today off work because I'm finding it quite difficult. I've been really tired as well.
Is there anything else in your medical history that I should be aware of? Any allergies or any other recent visits to the doctor?
I don't think there's anything that pertains to this injury. I am allergic to penicillin. I just found that out recently, actually. That could have been quite dangerous. And last year, I had the flu, really, really bad. But nothing that really relates to this.
It says here you play hockey.
Yeah, every weekend.
Any injuries that I should know about?
Not really. I've been pretty lucky, actually. A couple of months ago, I had a sprained ankle, which is pretty common in hockey. We usually have good trainers, though, and they keep an eye on us. We also take good care of ourselves.
Nothing serious then?
No, I've been pretty lucky.
And just take me through your family's medical history.
Just let me think about that. Well, there's hypertension and heart disease. Those are two things that have been there for my grandparents and my parents. My parents actually take it quite seriously, so they're eating a lot better these days. I do as well. And my grandfather had a stroke a few years ago. That was pretty hard, and now he's showing some early signs of Alzheimer's.
Okay, well, I'd like to examine you in a minute, but first I really need to make you understand you're going to have to stop the sports for the moment.
Oh, really?
Uh-huh.
That's kind of a tough one, Doctor. Sports are a pretty big part of my life. I mean, I really don't know how I feel about, it's pretty tough for me to sit still, and we have to do this big hockey tournament next week. Is there really no way I can play in that? I mean, I can take it easy when I am playing. There's got to be a way I can get out on the field. I mean, I've been working toward this all year.
Well, I can't stop you from playing, but I strongly advise against it because if you get hurt, you can cause some permanent serious damage. So you really need to rest and stay off your feet until we know what's causing these symptoms.
What if I'm feeling okay by next week? Would it be alright to, play then? If that was the case, I mean.
Part A. In this part of the test, you'll hear two different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
It's good to see you again.
Good to see you.
And we have already gone through your history and physical. We've decided that you are a good candidate for doing the bilateral fixation, SI joint fixation. That should help you a great deal. That you don't need the fusion, and that we don't need to do a piriformis release. So I think we're ready to go ahead and proceed with that if you're ready.
Okay, well, I have done a little bit of studying on this, and I've got some questions. I wrote some questions down, and I would like you to, if you could explain the surgery to me, exactly what I will be going through and what you'll be doing to me.
Sure. The first thing that we're going to do is the morning of the surgery, you're going to go to the preoperative area. And in the preoperative area, Vicki comes in the morning of the surgery, as well as I do too, of course. But she is going to manipulate you and make sure that you feel good and that you're in alignment, in good alignment. Then you're going to be taken to the surgery suite itself, and you'll be on the gurney in the surgery suite, and we will put you to sleep there. You also get IV antibiotics at that time, and at that time they'll set you up for the neuromuscular monitoring. They'll put little needles, and they are little, and of course, and you're asleep also anyway, but they'll put small needles in all the muscles so that during the surgery we can monitor that to make sure we're not near a nerve root. And then after that we will roll you into a prone position. The surgery is done with you on your stomach, so you'll be on chest rolls. Then we're ready. And then we'll go ahead and prep your back and proceed with surgery. Now you're having a fixation only, and what we will end up doing is putting 2 screws on each side. And the way that I determine where to put the screw in is first with an 18-gauge needle and then under the C-arm. I did mention earlier, of course, we have you on position so that we can use C-arm, which is for x-rays, or fluoroscopy, so that we can look through and see the bones. We'll stimulate the pin, and then we'll see if we get a response from the muscles. And if we do not get a response, we stimulate up to 20 milliamp level. If we do not get a response at about 50 milliamp level, we're usually very happy with that, even if we get a little response later on. But that makes sure that we're not close to the nerve roots, which are down here. Now, after we have the pin in the pin, we're happy with that, with the positioning on x-ray, as well as with the lack of response on the stimulation. Then we'll get a screw, a titanium cannulated screw, and put that over that guide pin, and then literally put it into the bone, screw it into the bone, and compress it. So, and then after we have the screw in, and usually I'll use 35 millimeter length screws most of the time. After we have the screw in, we'll test it again by stimulation to see if there's response on the muscles. And again, if there isn't, then we're happy with that. And then that's the first one.
Do you ever have to reposition a pin or move a pin out?
Sometimes if we start getting responses about 10 milliamps or below that, we're certainly going to reposition it. So we're happy with the first one. And then we put in a second one, which is essentially parallel, usually a little bit higher, pretty much parallel to the first one. And that's actually the end of the procedure.
Well, now, after this, how long am I going to be in the hospital?
You'll be in the hospital if you're local. We'll keep you overnight.
Okay. Okay. Now, what about my short-term restrictions right after surgery?
In the immediate period after the surgery, now we are going to limit your activity. We do want you to be active. We do want you to walk, but we want you to limit the prolonged standing or limit the prolonged walking to about 30 minutes.
Can you go up in that all, or like once a day?
You can. You can. You really will let you do what you really need to do.
Okay.
But just kind of be careful in doing it.
Okay.
The other thing we want you to not do is do any repetitive bending over, repetitive extending, which is really similar to most back problems.
Now, what about my long-term restrictions?
Long-term, as we talked about before, no bungee jumping.
I promise not to.
Okay. And then, but more significantly, even you don't want to do things that are going to be jarring to the back. Specifically, even stair climbing or not stair climbing, but the Stairmaster type of aerobic exercises. It would not do that. I think swimming would be much better.
What about yoga? Because I've done yoga for years.
Yoga, if you avoid the extremes of it, you can do the yoga.
I don't do the extremes of it. My body won't do the extremes of it. What about, I was curious about the screws. Do they ever work their way out?
No, they don't. There is a possibility they could possibly become loose, but really we've not had that problem either. The screws are made of titanium, and the titanium really attracts the bone to grow right up to it, much more so than stainless steel. So they're not going to work their way out on their own.
Now, is there a difference between a fixation and a fusion?
there is a difference. You're just going to have the fixation.
Okay.
And
That's good. That's good to know.
So these are really two different things.
That is, now, the other thing, when you fix the joint, which it's not moving anymore, do I lose any motion, or is my body going to be able to tell that?
Of course, the whole idea of this whole procedure is to limit what I call micromotion, which in this case you always are supposed to have a little micromotion in that joint. But if you have excessive motion, it leads to the problems like you have. So we are limiting that motion. We are twisting.
So I can continue on afterwards.
You can continue to actually do a lot better because it's not going to hurt you.
Exactly. That is true. That's true. Now, speaking of pain, what about post-op pain? How much pain is involved with this?
You are going to have some discomfort, especially in the immediate post-op, but it is it's a post-operative pain. It's not the same pain as what you had beforehand.
Okay.
And usually is not that severe that you cannot get up on the morning or in the afternoon after the surgery. We usually do these surgeries first thing in the morning so that, and then by the afternoon, usually we try to get you up with physical therapy. And most everyone responds that most of their preoperative pain is gone, if not all of it. But they still have some of the postoperative pain, but it's much more tolerable for them than the preoperative pain was. And of course, that's going to lessen. Even by the next morning, that's markedly lessened.
I am ready to have this surgery. You've answered my questions, and I think let's just go for it because I am very ready.
That sounds good.
Extract 2. Questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, I suppose you're George?
Yes, and I believe you're Dr. Mark?
Oh, yes, I am. What brings you here today?
Well, I'm having this redness in my, in the white part of my eye, actually.
All right.
I think, I don't know what it's called. Is it called the conjunctiva or something? Mm-hmm. It's quite swollen, and, you know.
I can see that,
yeah. You know, I've been having more tears than usual. Like, you know, it's, more than tears, I think it's, you know, sometimes I can feel that it's sort of like a yellow kind of discharge.
Yellow?
Yeah. And like, I mean, it crosses over the eyelashes, you know, and, you know, when I go to sleep, it's not, during the daytime, it's not really bad, but when I go to sleep and I wake up, you can see that, like, you know, it's quite thick.
Do you have any particular sensations there?
It's quite itchy, you know, like, you know, and I feel sometimes burning, like in the eyes, and I'm not sure it's because of this discharges or whether anything else is happening. I feel like my vision is quite blurred. So, and I mean, I believe the sensitivity to the light has changed as well. Like it's how do I call it? It's like stubby.
Stubby.
Yeah. And I just, like, you know, don't have anything else, just these things, and, you know, I have other allergies and everything, but I don't know whether it is associated with it.
All right. Allergies, you said?
Yeah. I'm allergic to pollen. So
dust?
Like, not very much. It's hard to, I mean, pollen is, you know, it's tested, and, you know, I am positively allergic to pollen.
Okay.
And, you know, sometimes I get common cold and, like, you know, not like, you know, not a lot. You know, so I would love you to do, like, probably an eye examination, and, you know,
We could do
just,
that.
yeah.
There is a thorough history collection in the laboratory.
Yeah, no, so I believe I'm going to have to give some blood or something like that.
No, you don't have to.
Yeah.
You could rest assured.
Yeah.
Always do keep the eyes clean, please.
Yeah. I'm pretty, like, I've had it when I was a child, and, I remember, I washed my, wash the eyes with clean water. I change the pillowcases every day, morning. And, I think, I have to do until the infection goes away. But, it's not my expertise. It's more of your expertise. So, I do the basic do's and don'ts, and, I don't touch both eyes, or with the same finger, or I don't rub.
Right.
I just don't I don't want to spread it to the other eye as well. So, and hopefully, like last time when it happened, the doctor gave me some eye drops, and it's just the regular things, I believe. But I feel like I'm a bit of a fraud coming in just for a bit. It might be something silly, but.
You did the right thing.
Yeah.
So I would ask you not to put a patch over the eye.
Yeah.
It might worsen the infection.
Yeah.
And protect the eyes from dirt.
Yeah.
Especially from the irritants you mentioned.
Yeah.
And did I forget to ask you to take enough rest?
Well, I've not been doing much. I started off using, when it went, on the first day, when it happened, I thought, I'd just, look at it, and I don't want this to go bad or something. So I used an over-the-counter eye drop. I tried it to start with, and now. My vision is a bit blurry, so I'm not, watching TV or anything. I'm just get a bit of rest. And
I'd also ask you to stay away from work for a few days. If it's okay.
Oh, that's not really a bad thing. If you're happy to give me a sick certificate. I'm physically feeling really good, actually, but it's just, I don't think it's safe as well. I work, in a chemist as well. I'm not a pharmacist, though, actually. I just, just read scripts and things and assist a pharmacist. So I don't think it's safe enough with this condition. I should work. So,
for that, I'll prescribe you some antihistamines as well.
Yeah.
Okay.
Yeah, so I think that'll be good. I'll probably take some rest and, take the medications. And do you want me to see me next week, or just you want to know how it goes, or like?
How about in 4 days' time?
Okay, cool. So I'll try it, and if I can work it out, I'll do it. Great, thanks. Nice meeting you, Doc.
All right, cool. Yeah.
That is the end of Part A. Now look at Part B.
That is the end of Part A. Now look at Part B.